Okay, hi, how are you? Good,
Yeah, hi,
good.
how are
Thank you for
you?
joining me today.
Oh no, my
Um,
pleasure. Thank you for having
so,
me.
you know what? I know we spoke yesterday a little bit, but I wanted our listeners to hear about you. And if you could just introduce yourself to my listeners, they'd be very interested to know what you do, and they're very excited about what you have to share today.
Yeah, absolutely. So hi everyone. I'm Dr. Funke Afolabi-Brown. I am a sleep medicine physician. I'm also the founder of Restful Sleep MD. And my mission really is helping moms and their children prioritize sleep so that they can live to their fullest potential. And I'm so
Okay, great.
excited to be
And
here.
where are you right now? Where are you located?
I'm in Pennsylvania, probably about 30
Okay,
minutes
okay.
from
And
Philadelphia.
you're going to be soon starting your telemedicine practice, is that right? And for the end of the year. Okay, great.
Mm-hmm.
Okay, so we'll add your
Yes,
details at the end
yes, yes.
of our talk today. But I wanted to talk to you a little bit about why you are so passionate about sleep medicine and what made you want to focus on this for your practice.
Yeah, no, absolutely. So I think it came from a place of struggling with sleep myself, right? As in my
Mhm.
training, right? I'm sure
Right.
in yours as well. Sleep was never sleep was never a thing. In fact, if you're someone who likes sleep, it seems like you're lazy, right? There was this narrative about just hustling and grinding, and I felt like I was burnt out almost as soon as I walked through the door. And so went through all that and then, got into medical training and the residency, and then kids came along and they don't read any manual as well. They're not sleeping. So
Mhm.
I just struggle through it all. And so I think that really got me fascinated with sleep because I then started to understand why sleep was so important for me personally. And then I went ahead and did a fellowship for in sleep medicine just to really better understand it because I realized that when I sleep better, I
Right.
am functioning all around better. So I wanted to help more people. And then fast forward to my own daily employed practice. I'm seeing a lot of kids with sleep issues. But then one of the things I was hearing as a recurring theme was the
Mhm.
parents are still not sleeping. So that's really what made me embark on my journey to help
Okay, yeah,
improve sleep
yeah, and I
health.
think that's so important. And like you said, we are so chronically sleep deprived as parents, I think. And I think I was in shock when I had my children, realizing that I was up all the time, completely non-functional, I think. And so I think
Yeah.
that's very important. And so very important for us to understand that sleep is very important, just as important as, diet and exercise,
Mm.
if not more, for us and for our children. So tell us about sleep in kids. So how much sleep do kids need? And I know it's different across the ages, but
Mm.
if we're looking
Yeah.
at, adolescents, let's start with that, this adolescent age group, 13 and above. What do you think is a good amount of sleep for them? Because I have a teenager right now and she sleeps a lot. And I just wanted to hear from you, how much sleep do they need and why is it important?
Yeah, absolutely. So the way it is
Mhm.
sleep needs change, just like you said. The National Sleep Foundation actually has established guidelines and recommendations about how much sleep each sort of age group needs. And so, infants are sleeping anywhere from, 11 to or 14 to 17 hours, newborns, for instance. And then our teenagers, right, about 13 and over till about 18, sleep anywhere
Mhm.
from about 8 to 10 hours. And I think really, really, really a lot of kids are sleep deprived. They're really not getting that. Or they're sleeping really,
Mhm.
really short amount of time during the week. And then they try to
Right.
make up on the weekend, right? So that's something that we see that's a
Yeah, so you're
prevalent problem
saying
too.
13 and above are teenagers at least 8 to 10 hours a night. Right. And then what about the younger
Mm-hmm.
age group? So what
Yeah.
if we're, looking at, you
Yeah.
know, 5 to 10 or 5 to 12-year-olds?
Yeah. Yes. So the way it is so like I said, that newborn stage, 14 to 17. Then around that, like 4 months to 1 year, about 12 to 16 hours. Again, give or
Four
take,
months
right?
to
This is a
six, four
wide
months to
range.
6 years. Is that what you
And
said?
then for,
Oh, to 12.
no,
Okay.
4 months
Yeah.
to 12 months. So 4 months to a year, exactly. And then, our preschool, so that's,
Mhm.
think 3 to 5, sleep from 10 to 13
Okay.
hours. That's the recommendation. Then our school age kids, which would be from about
Mhm.
6 years old to 12, sleep recommended to sleep about 9 to 11 hours. So that's the recommended range. Again, this is such a wide range. I think at the end of the day, even beyond that magic number, because you might have, say, for instance, a school age child who is sleeping about I don't know, 9 hours or 10 hours of sleep. If they're still tired, if they're still feeling sleepy in the morning, if they're still having focus issues during the day, at
Mhm.
times they may need just a little bit more. So again, this is such a range. You have to watch your child to get a sense of whether they need a little bit more versus they need a little bit less. And I think
Yeah.
that's why the
Okay.
range is so
And
wide.
a lot of parents are asking here on the Instagram Live about how to get your kids to sleep those hours, right? Because, they're
Yeah.
so preoccupied with other things, or the teenagers have homework to do, and they're staying up late to
Mm-hmm.
get that done,
Mm,
or kids are on
yeah.
screens. So, can you talk to us a little bit about the importance of routine and how, if you have any suggestions for parents as far as how to get them to get to bed on time? Because I think that's a struggle for all of us.
It, it is a struggle. So now the strategy for every age group sort of differs a little bit, but there's some fundamental things, right? So the first thing to realize is the expectation. First, set an expectation. Like, how many hours does your child really need? And I will tell you, it does sound like a lot of hours, but think about it. Until they're about 4 years old or 5 years old, they're taking naps. So that total amount of sleep includes the nap, right? So you may not get your child sleeping a whole, say, 14 hours
Mhm.
overnight. So that's where the naps come in. And, by the time they get to about 4 or 5 years old, typically they'll outgrow the nap. And then the idea is to have that consolidated sleep overnight. Now, in terms of, so that's first setting the expectation, right? So, and then your teenagers, for instance, you can't necessarily try to get your teenager to sleep 11 hours because that's too much. They don't need that. And all that's going to cause is frustration, right? So now when it comes to getting your children to
Yeah.
sleep, that's what I do all day. So, so what I recommend is exactly what you said. Apart from setting those expectations, is having consistent routines. I think that's really important because even though, our body sort of has this what we call a sleep drive that helps us to know
Mhm.
when it's time to sleep and we start to feel sleepy, your child is rubbing their eyes. Having a routine helps cue their body to say, yes, it's evening time and it's time for you to sleep. And really, what are those routines? Many parents end up complicating the routine. It becomes this long, drawn, frustrating activity because the kids are running all over the place. My recommendation is keep it really short and sweet. What does that mean? 2 to 4 activities that are pleasurable for both parts of the team
Mhm.
and are heading in the direction of the bedroom, right? So things like brushing their teeth. But if you notice that you have a toddler who hates brushing their teeth, then maybe don't put it close to bedtime because what that's going to do is cause a lot of frustration. So you want to push that to the beginning of the routine and then do maybe a bath
Mhm.
time, wear your PJs and do some reading, and then they go off to sleep. So I think that's just something, and you can modify that based on their age. So even your teenagers still need some
Right.
kind of routine. Even you as
Right.
a parent,
Right.
as a role model, you do need routine. It does help cue your brain for sleep. So when it comes to that, if you notice that your child is either pushing back, there's so many reasons why kids may push back, right? There's so many reasons why they may have difficulties falling asleep, as well as
Mhm.
difficulties maintaining sleep or staying asleep. Many times the struggle may be about bedtime battles, right? If you have a routine that's very simple, that's sort of predictable, that eases that burden for some. Another thing that I use, especially for younger kids, is a bedtime
Mhm.
chart with rewards. So make it simple. Again, don't make it anything too overwhelming for you. Create a chart with either drawings or steps as part of their
Yeah.
routine and let them be a part of that. so that they can either put a check mark once they're done with that routine, and then they go on to the next one. And then the other piece is also limit setting, right? If you set those expectations and your child is, say, not doing what they're supposed to do, you of course ignore negative behavior. If you start to see them follow along and do the things you want them to do, you reinforce the positive behavior. So it's the same kind of similar strategies that we'll use to address behavioral issues during the day. We just modify it a bit to
Yeah,
help with
okay, great.
facilitating
Great advice.
bedtime.
So you had said, make sure that they have a routine, but keep the routine short and sweet. So just
Mm,
a couple of things to do, right? Brush your teeth, take a bath, shower,
mm,
read.
mm.
Maybe trying a chart for the younger kids, and then really reinforcing the positive behavior for these kids.
Mm.
Because I think, they always want to stay up later. And then, the end result is oftentimes a battle at bedtime to try to get these kids to go to bed on time. And then, like you said, it limits the parent time
Yeah,
also to sleep and limits their routine setting. So I think that's very important. Um, so I want to shift a
yeah.
little bit and ask you, the reason that I'm very interested in this topic in particular and having you speak, you're an expert in this field, is what happens when kids don't get enough sleep? And, from our perspective, we have seen a link with hormone abnormalities, with poor sleep. We have seen higher levels of ghrelin levels, which, increase appetite in kids when they don't sleep enough. And so I wanted to talk to you a little bit about, what happens, what do you see, not just from a hormone perspective, but, in other areas of children's lives when they just don't get enough sleep?
Yeah, so many things can go wrong when our kids are not getting enough sleep, just similar to us as adults as well. Except with our children, right? They're going through a rapid phase of development. So sleep is just so important. So the first thing I really see a lot is first
Mm-hmm.
impact on their learning and behavior. So you may start to see a child who either starts to not do so well in school, may have more irritability, may
Mm-hmm.
have issues with impulsivity, emotional self-regulation. So that tantrum during nap time in the grocery store because they don't want this giant lollipop before lunch might be related to the fact that they're really tired and irritable, right? So you see that you may sometimes see daytime sleepiness in the older kids, but it turns out what we end up seeing
Mm-hmm.
in younger kids is hyperactivity. So they may just be bouncing off the walls and you're wondering what's going on. And you may think, okay, maybe they need to play outside some more, but at the end of
Yeah.
the day, what they might actually need is sleep. And then, with our teenagers, I see a lot of, mood problems too. Anxiety, depression has been related to insufficient sleep, as well as increased risk-taking behaviors.
Mm-hmm.
So we can see things like substance abuse, car
Mm-hmm.
crashes as well for our teens that are driving. And then, you mentioned some of those hormonal changes because when you're chronically sleep deprived, what it ends up doing is it increases just the entire inflammation in your body. So cortisol levels are going up, stress levels are high. So you may see different manifestations. Like you mentioned, the hormone, there's a flip in the way your appetite hormones are regulated, where leptin, which is sort of that fullness hormone, and is
Mm-hmm.
supposed to be on the higher side, kind of drops. And then
Right.
ghrelin, which is the hunger hormone, increases. And what that ends up doing is it's going to make your
Yeah.
child just hungry all the time. And so they don't seek out like healthy foods. Usually they'll seek out more of the
Yeah.
high carb, sugary things, the sodas and things like that. And you can imagine that that's how the weight gain comes up. And then motivation also decreases, right? And they've actually done studies to look at this where they looked at kids who had, I think they were fourth grade to seventh grade, something, don't quote me on that. Lots of children, over 2,000 children. And they looked at those who had insufficient sleep and just their the trend in their appetite. And of course, they saw they wanted more of the
Right.
sugary foods, the high carbs and things. And they also looked at their activity levels, right? The recommendation is about 60 minutes of physical activity for our kids. And the likelihood of not meeting those recommendations is higher in the children that don't get sufficient sleep. And guess what happens when you're physically active, right? You're more likely to keep up a healthy weight. So we can see how that kind of can
Right.
then lead to things like obesity because of the higher inflammation over time, they can develop hypertension, kind of like adults. They can develop, some heart disease, diabetes, and things like that. So honestly, I just feel like it
Mhm.
impacts them all
Yeah.
the way from the top to the
Yeah, I
bottom.
agree. I mean, it does affect
Yeah.
everything. And you mentioned, I mean, the mood and anxiety and depression and older kids is important. And then these
Mhm.
tantrums that they're having and learning issues in school, I think that's manifest
Yeah.
oftentimes. And so, sometimes it's important to kind of
Mhm.
evaluate the whole child picture and see what is it going on before, having kids on ADHD medications or even obesity medications or any of
Yep.
those kinds of things, right? So really important to evaluate the
Yeah.
sleep from, like you said,
Absolutely.
the top down, just to really see how it's impacting everything. The next question I have
Mhm.
actually from some of the listeners here is, so, say your kids are doing all these things that you recommended, right? So they have a bedtime routine and they have, they're limiting screens at bedtime. And they're still not able to sleep. When is it that they would come to see you, and what would it be that you would do for them?
Yeah. So there are different reasons. I mentioned sometimes it's just bedtime resistance. Sometimes it may be related to bedtime fears. You might have kids that are scared of the dark. You may have kids who may have a little bit of separation anxiety. So we have some strategies that we can put in place to help with that. You might have a child who has difficulty with sleeping independently, and so maybe they fall asleep with you laying next to them at bedtime, and then in the middle of the
Mhm,
night they keep needing you to return. So those are all that what I just described.
mhm,
They're under the umbrella of behavioral sleep issues. And I help with taking care of kids that have those issues. It's a lot of kind of coaching. Essentially, what I'm doing is I'm coaching you to coach your child to sleep independently as a skill. And it's never too late to do that. Some, people call it sleep training, independent sleep training, whatever it is. Essentially, you're helping your child to develop those skills.
mhm.
So that's kind of the behavioral bucket. And then the other bucket is more of the medical bucket, which is really some of the work that I do, where you have a child, say, for instance, they are in bed and they are, they're tossing and turning, they're not bothering anybody, but they just cannot sleep. Either their legs are uncomfortable, sometimes it might be related to restless leg syndrome. And that takes really asking and keying in on what's going on. Some of the flags you'll hear is your child may say, can you rub my legs? Or my legs feel weird, or I have spiders on my legs. So that might be a clue that, okay, this child might have restless leg syndrome. And what we usually do with that is we will do an evaluation with an iron level. It's really often related to low iron stores in the blood, because if you think about it, most of our kids may not necessarily
Right,
be going after the green leafy vegetables. So
right.
a lot of kids are iron deficient. So that's usually something we could fix easily. And some
Mhm,
other blood work we might need to do, especially if we've ruled out behavioral issues. And then another thing that can disrupt their sleep, that doesn't necessarily cause difficulties with falling asleep, is sleep apnea, right? Where you have pauses in your breathing during sleep. So if you have a child that's having frequent snoring, gasping, pauses in breathing, where they are, or, they are waking up and they're constantly having these wake ups in the middle of the night. Sometimes they may not fully awake. You just may notice that in the morning, they just look really unrefreshed or they're tired and things like that. In that case,
mhm.
what I recommend is getting a sleep study. And so that's a test where we essentially are watching their breathing during sleep to really see if these pauses are related to true apnea or if it's just plain old snoring. If a child has sleep apnea, the mainstay of treatment is surgery, where we take the tonsils and the adenoids out. In some children, especially in children who are very overweight, that might not be sufficient. And so they may need CPAP,
Yeah.
similar to the ones the adults use, right? With the interface and the compressor that just kind of pushes air to the back of the throat. And then you can also have some really sort of relatively rarer medical conditions that can affect sleep, like narcolepsy. It's not as uncommon as people think, and sometimes it presents in a very subtle manner where the child is just profoundly sleepy. They're having sleep attacks during the day. Sometimes they may have what we call cataplexy, where they have low tone, suddenly loss of tone during the day or triggered by emotion and things like that. So once you start to see, like, my child is getting enough sleep during the night, but they're still excessively sleepy during the day and they're having some of these other symptoms, that might be a clue to have
Okay.
them see
Okay,
a
great.
sleep
This is
specialist.
really great information because I think there's a lot of things that parents just don't understand really about sleep. And some
Yeah.
things that, may need to be assessed and addressed by someone like you, which is very important. And I agree with you. I think, the green leafy vegetables, these kids are, not eating. And so that's probably more common than we actually think as far as the restless leg syndrome for these kids. Um, so
Yeah.
I
Mhm.
guess, final words I wanted to just, get from you a little bit about, any medications that you use and for sleep. And, a lot of parents are using over-the-counter melatonin, medications. And this is not meant to be
Yeah.
a topic for, I mean, we're not giving medical advice. This is just for educational purpose. A sense from you as to, do you have an overall thing that you tell parents, when they say, I want to use melatonin for my kids? And what do you say?
Yeah. So my philosophy is about really getting to the why, what's going on, right?
Mhm.
Melatonin may seem like a quick fix, but then I think it's important to figure out why they need melatonin. Are there behavioral sleep issues they're having? In which case, you may not necessarily see any improvement with melatonin because our brains produce adequate enough melatonin. And there are a few conditions that melatonin will be helpful in. If you have a child who maybe has sleep issues and they also have things like ADHD or autism or some other conditions that we diagnose, melatonin can actually be effective, no doubt about that. If you have things like jet lag or shift work sleep disorder, or you have a teenager who has a biological or circadian rhythm that's shifted, sometimes we'll use melatonin to help with adjusting their body clock. But other than that, honestly, we've not necessarily seen melatonin as a cure for insomnia or things like that in children. But that being said, some people will try it maybe on the short term. It's relatively safe, but you do need to be careful. There have been some side effects. Some kids may have more nightmares. They may have bedwetting. They may have a lot of daytime sleepiness. Some kids can have behavioral issues when they're on melatonin. And then a lot of times people just give
Yeah,
too much
yeah,
melatonin to their kids too. So, because of this, and because I know that there are just a lot of things we can do from a behavioral standpoint and also from the medical standpoint, leaving just a really small category of kids that truly do need melatonin. I always often say at the end of the day, try to address those. If you do need to use melatonin sort of as a bridge until you get to why they're having the sleep issues, that's completely fine too. But if you start to notice, say after 2 weeks, that your child is constantly needing the melatonin, you definitely want to speak with your doctor because then, there may be more going on
yeah.
that can be, that
Okay.
we could
Okay. This
address.
is great information. This is so helpful um, for our listeners and for me also. I learned a lot today from you. Thank you. I appreciate this. So where can people find you? And I know you do a lot of speaking also. And so where can people find you?
Yeah, so
Good.
thank you
Yeah.
for having me. This has been fun. So I'm on Restful Sleep MD.
Uh-huh.
That's my handle on Instagram and also on Facebook,
Okay.
LinkedIn. I'm Dr. Funke Brown, and I speak at conferences, webinar sessions, whatever it
Okay.
is. I
Yeah.
speak if it's
I
about
know.
sleep.
That's where we saw
I'm
you. And
happy
Dr.
to
Funke
speak
Brown was
about
on
it.
ABC News also. So if you, Google her, you can find her information. And I'm so grateful that she's been able to take time out of her day to speak to us today. So thank you so much.
Thank
Okay.
you.
Thank you.
Thank you so
Take
much for
care.
having
We'll
me.
be in touch. Okay. Bye.
Take care. Okay, bye.